Welcome to the Healthier Pregnancy presentation series. I'm here today with Dr. Maureen Phipps from the Warren Alpert Medical School of Brown University, Department of Obstetrics and Gynecology. She's also affiliated with Brown University School of Public Health and Women and Infants Hospital. She's here today to discuss the Affordable Care Act covered preventive service of screening and management of obesity in pregnancy. So thanks so much for taking the time today to provide more information on this really important topic. Why don't we start by you telling us a little bit more about your background?
Great. I am a practicing obstetrician gynecologist. I see both pregnant women and non-pregnant women. Today we're going to be focusing on pregnant women. I lead the Department of Obstetrics and Gynecology at Women and Infants Hospital in Providence, Rhode Island, where I see patients both in the clinic setting as well as in the hospital. Take care of women throughout their prenatal course. I lead an interdisciplinary team that helps to manage patients throughout pregnancy. We also have a very diverse population of women, so we have many resources that we help to optimize birth outcomes for all populations of women.
That's great. So it sounds like you have a tremendous amount of experience. And so why do you think it's so important for people to think about this sort of service for all prenatal patients?
Well, when we think about the obesity problem in the United States, it is growing. We have about 30% of the population in the U.S. qualifies as obese. That is a significant problem because of the health issues that are associated with obesity. High blood pressure, premature death, diabetes, those are very big concerns. And the U.S. Preventive Services Task Force has a recommendation that all adults are screened and then referred for management if they qualify as obese. But today, we're talking about obesity and pregnancy. And the U.S. Preventive Services Task Force doesn't address that directly. So we're going to use the resources from the American College of OBGYN as well as the Institute of Medicine, which provides us a lot of information about how to care for our pregnant women with obesity. The issue in pregnancy is as big a concern as it is for non-pregnant patients. There's about somewhere close to 30% of women presenting in pregnancy also are either overweight or obese. Mm-hmm. So, well, why is that an issue? That's a problem because the issues associated with pregnancy and obesity include gestational diabetes, hypertension, preeclampsia, and problems with actual labor and delivery. So those are pretty significant, and what we're trying to do is to help women manage their weight during pregnancy so that we can optimize outcomes for them as well as their babies.
So I think probably the question on a lot of people's minds at this point, though, is yes, it's important, but how do we screen for this given that, you know, a certain amount of weight gain is normal and it's kind of this sensitive topic with women? What do you recommend in terms of screening?
Well, it is a sensitive topic. It's sensitive because of a lot of issues that have led to somebody to be obese, and how do we help them manage during pregnancy? So what we do is we have specific screening tools. When we think about obesity and how do we screen for obesity in any practice setting, we use a body mass index, BMI. And that takes into consideration a patient's weight as well as her height. So its actual calculation is kilograms divided by meters squared. But most of us, weigh ourselves in pounds and we measure ourselves in feet and inches. So there are a lot of tools that we can use that are readily available on the internet that you can convert your weight and height into a BMI. So those are some of the tools a provider could use. In addition, most electronic medical records also have that capacity already built in. You put in a patient's height and weight, and it will tell you, it will calculate the BMI for you. So that's the first screening tool. Mm-hmm. You find out a BMI, and if a patient's BMI is 30 or above, that's a category of obesity. And that's when you need to then think about how do we counsel a patient? What can we do to help them optimize their birth outcomes? So when we start there, if a patient comes in and she has my team, whether it's my medical assistant or whoever, my nurse who's doing their first measurements, will put in their height and weight, and I will have a calculation of their BMI, and I'll note that it's 30 or above. You got to formulate a plan. You got to think about, what is it now? What do I do to counsel this patient? Well, this is where the Institute of Medicine, or the IOM guidelines, come into play. A woman who is obese, BMI of 30 or above, has a recommendation to gain between 11 and 20 pounds during their pregnancy. That is not a lot of weight in pregnancy. So you've got to think about that, because most women will come into pregnancy with the expectation that they're going to be gaining a lot more weight than that. So you have to really think about, okay, what's my plan to come in to that setting? So you think about it, and you want to formulate the conversation with the patient about how she feels about her weight right now. She probably recognizes that she maybe have obesity, or maybe above the weight that she'd like to be. And you got to understand how she actually got to that spot. Is it a weight gain that has been with her whole life? Has it been recent? Lots of issues around that. So we're really think about talking with her about your weight gain goals, 11 to 20 pounds during pregnancy. And then you got kind of pause and have her think about that. She may or may not respond during that time. This is a conversation that's ongoing through pregnancy, because during the first trimester, you're going to actually recommend that she not gain very much weight at all. Mm-hmm. It's actually later in pregnancy, in the second and third trimesters, you'd recommend probably 0.5 pound a week. Mm-hmm. And that's a very specific recommendation. You might talk about what's her understanding of calorie counts and foods, mm-hmm. because that's really essential. 0.5 pound a week during pregnancy is not very much. Mm-hmm. So you're talking about somewhere about 250 to 300 extra calories per day. That can be a handful of almonds. It's not a whole lot of food. It could be a granola bar, helping her understand that we are not talking about lots of extra calories during pregnancy. So that's kind of starting around the calorie counts, but then you've got to also think about nutrition, because it's not just, all calories are the same in pregnancy and beyond. You do want to think about good nutrition. So whole grains, fruits, vegetables, really thinking about healthy proteins and avoiding those kind of empty calories that are fats or high sugar foods, those types of things.
Yeah, I think you bring up a really interesting point that for some women there's a lot of education that needs to take place about nutrition, mm-hmm. and what's going on. Do you ever find that there are some women that maybe food is a way that they've coped with things they've experienced in the past, stressful life experiences, and do you approach those women differently?
Absolutely. That is probably more common than not. So you need to have kind of a full spectrum of resources and anticipate that this may be how they do cope with their life, or it's how they celebrate. So it's it doesn't have to be negative. It could be extremely positive, but it's just part of their life.
That's a good point.
So alternate, to helping them understand that could actually have consequences during pregnancy is a place to start. But also, you need to engage your team. Mm-hmm. So we have social services that helps us, social workers, also a behavioral health team who can help us if there are issues that are tied beyond really education about nutrition. So that's a really key and important thing to understand.
Okay, so it sounds like the interventions kind of vary depending on what's going on?
The intervention may vary, the recommendation doesn't.
Okay.
But the recommendation isn't only about nutrition and calorie counts. You've got to also bring in physical activity. So the recommendation around physical activity, or just counseling someone about physical activity, is finding out, what do they do now? Are they sedentary, they don't do much activity, or do they do a lot of activity, but they've just have more calories in than calories out? or energy out. And so understanding that helps you to guide a patient to increase activity. Usually I center around walking. Most of the patients that I am working with are probably more on the sedentary side. So we just talk about walking. 150 minutes a week is kind of a goal that I set with them, 30 minutes a day, kind of try to help them work through it. It's really critical that you kind of make a kind of an agreement or an understanding with the patient of how they'll monitor it. Self-monitoring is a really key piece here, where we want to make sure that they have control over it. They can monitor their food intake as well as their activity, and that sort of helps them get to what it is real, that this is actually something that they have control of and they can make a difference in their outcomes in pregnancy.
Any other tips for success for your patients? I mean, in terms of diet, in terms of physical activity, what are the key components that they need to know?
Yeah. Sometimes, depending on the individual, and you'll gain this through different conversations throughout pregnancy, because you're coming back. Every time they're coming back, you have a weight on them, and it's a time for you to discuss how they're doing. So you can tweak things along the way there. Some patients, some women want to weigh themselves every day. It's actually a technique that people use outside of pregnancy to help manage their weight. And that is fine as long as they don't get too consumed by it, because obviously pregnancy is one of those times where weight variations definitely change, can change dramatically. So it's a lot of monitoring, counseling, helping the patient along. If she is in a category that will qualify for assistance through the WIC program, Women, Infants, and Children, you want to make sure you've made that referral so she has access to healthy foods and affordable healthy foods. So that's a really key element of this as well, and that's also part of our nutritional program. Okay. I think one of the other parts of this is that understanding her resources and her environment. So I said 150 minutes a day to walk or get exercise. You kind of have to understand, is she in a safe neighborhood? Are there walking programs? What does she have access to? Because that may be the actual barrier to her getting activity. So you want to understand that and try to help troubleshoot through
Yeah, that is such an important point, that somebody may not live in a community where they're able to walk outside for 30 minutes. So what else do they have access to? What would you say is the biggest obstacle for, getting these screenings into place and doing them and getting services into place around obesity for pregnant women?
Well, I think the screening is having providers be comfortable with actually making the recommendation. If it's the IOM recommendations are readily accessible. Some people put it on a pocket card or their handheld, whatever it is, so that they can be reminded. And that it's a sensitive issue. Weight is a sensitive issue. Yeah. Being able to start having that conversation and being sensitive to where the patient is, I think will actually help providers feel more confident in making the recommendations. Understanding calorie counts themselves, what physical activity expectations are. Those are all tools that a provider can bring to the room with the patient. Mm-hmm.
So one sort of understanding that it's okay to ask about these sensitive topics, but then also having some education about what information you're providing to the patient.
Yes, absolutely.
Mm-hmm. Mm-hmm. What do you think that the healthcare system needs to have in place to be supportive of these interventions?
Well, I do think the WIC program is tremendous to help provide healthy foods and availability. The healthcare system support for having nutrition consultation and support for any interventions that are necessary beyond just a provider, or whether the provider is a physician or a nursing intervention. We may need, behavioral health interventions, those things that will actually help a person, a woman, during pregnancy optimize her weight gain, but then it's beyond pregnancy as well. You want to have lifestyle modifications that can continue after pregnancy.
So really an interdisciplinary approach and a longitudinal approach.
Absolutely.
Okay,
yes.
That's very, very helpful. I mean, do you think that you want to share a couple of takeaway points for folks? I mean, you've given us a lot of things to think about. What do you think are sort of the most important things for people to think about when it comes to screening for obesity in pregnant women?
Great. Well, I think that really being conscious of that you are screening, the BMI is a screening tool, then using that BMI to then understand what a weight gain target is for an individual woman, and then really being thoughtful about how that translates into how she can actually achieve her goals or make progress during pregnancy, and also help her understand that this work is being done in order to improve outcomes for her and her baby.
Mm-hmm. These are great points, and thank you so much for talking with us about this very important topic today.
It was an absolute pleasure. Thank you.
Thank you, Dr. Phelps.
Thanks.